So this is a lecture on the shoulder girdle muscles. Particularly, we're going to be looking at the ones in the posterior compartment. The first one that we look at is the levator scapulae. Its origin is going to be in the C1 to C4, and the insertion is going to be the medial border of the scapula. Its main job is for elevation, in particularly when we're looking at elevation of the scapular joint. The rhomboids, one of the interesting aspects of the rhomboids is going to be the difference between rhomboid major and minor. So they do work together. Their main job is for adduction. They draw the scapula towards the spinal column. So when we're looking at this picture, we're looking at the basic movement of drawing towards. If there's one thing that the rhomboid major and minor do is for stabilization of the scapula, particularly stabilization along the medial border. They're not really considered to be a prime mover. They mostly are going to do two particular motions. One, they are going to draw the scapula down in downward rotation whenever we're looking at upward rotation. So I'll just draw here. In the lecture before, we talked about upward rotation, and so what we're going to be particularly looking at or focusing on is the ability for rhomboid major and minor to draw the scapula into a downward motion. They do slight upward motion, but again, their main job is for stabilization for the position of the scapula. The serratus anterior, this one in particular, a lot of emphasis should be placed on the serratus anterior, mainly because its job is for abduction or protraction. So whenever you're lifting your arm over your head, what we see is the upward rotation. So it is going to actually do an upward rotation, and it is going to draw the medial border away from the vertebral column. Its origin is on the upper side surface of the first 9 ribs, and then it inserts in the whole length of the medial border of the scapula. So you have to actually envision this muscle going underneath and grabbing a hold of the medial border of the scapula. This one particularly, what we see is dysfunction whenever we see people with winging of the scapula. So when we see the medial border pulling away from the posterior side of the body. The next one, pec minor, I think the most important thing is that it not only abducts, but more importantly, it depresses the scapula. When we were talking about scapular movements, it originates on the 3rd and the 5th rib, inserts on the coracoid process here. And its job is to depress the scapula, which we know in particularly we only have about a 5-degree depression of the scapula. So not a lot of movement, but in particular what we're looking at is just drawing the scapula down the back in particular. The trapezius is interesting because we have 3 different fibers. The upper fibers, which we'll see the fibers are running at an oblique angle towards the origin. These are going to be doing elevation of the scapula, and they also do extension of the head. The middle fibers, which run more parallel here, they're also going to be involved in elevation because they're connected into the superior aspect of the scapula. But their job also is to do upward rotation. So when we're looking at the inferior angle going up, it's going to pull or upwardly rotate the superior aspect of the scapula towards the spine. And then the lower fibers, again, running at an oblique angle. We see mostly depression, a little bit of upward rotation, and mostly adduction or bringing the scapula back to the midline of the body. So the rest of the slides, what we're going to be looking at is particularly prime movers during particular movements. So when we're looking at the scapula in particular, what we're looking at are the prime movers. So an agonist is considered to be a prime mover. So for abduction or moving away from the midline, what we see is that we're going to see again pec minor and serratus anterior. For scapula adduction or moving towards the midline of the body here, what we're going to be seeing is the agonists are going to be the middle fibers here of the trapezius, so more of the superficial, and then the deep fibers of the rhomboid major and minor, remembering that they work together. Upward rotation, I think the most important one on this one is going to be the serratus anterior, but the lower and the middle fibers also do upward rotation. So again, when we're looking at upward rotation, we're going to see the inferior angle moving this way. We're going to see the lateral border rotating this way, which is coming from the middle and lower traps here. And then the serratus anterior is attaching to the medial border, which also provides upward rotation. Downward rotation, mostly through the rhomboids and the pec minor. And elevation, we talked a little bit about this, where we see elevation from the superior border, from the levator scapulae. We see the upper trapezius fibers, which run in an oblique fashion to the superior border. And we also see the upper portion of the rhomboids, allowing for slight elevation in the scapula. And finally, depression, very small movement, but mostly depression is going to be the pull of the oblique lower fibers, and then again the pull of from the third to fifth rib of the pec minor. So just a little short lecture on the agonist or prime movers for some of the scapular motions.